Welcome, everyone. It's Dr. Lindner, and what we're going to be talking about is ranges of motion and understanding what some of these terms are. When we look at range of motion, it's important to understand and not just memorize, like, the rhomboids adduct the scapula or the pec major internally or medially rotates the arm. It's important to know what they look like. Generally speaking, when you see the word flexion, it means that we're decreasing the angle between two bones. When we're talking about extension or extending, we're increasing the angle between, right? So if, let's say, here's a straight line, right? And let's say there's the elbow joint. Once we go like this, and we see this is flexion, right? We moved from this starting position to here, right? We moved upwards. So we lessened the degree, lesser than 180 degrees, maybe 100 degrees. But if we go back down in this direction here, now we're increasing that angle, we're extending it. Hyperextension, hyper, is if you go beyond that, if you extend past anatomical position, if you hyperextend the elbow, okay? So let's look at flexion and extension relationship to the head, neck, and trunk and the extremities. So let's say we start right here in neutral position with the head and we bend it forward, that's flexion. Once we go from flexion and we go back to neutral, we are extending the head. And if you go beyond that position of neutral, now you're hyper extending it. You're going past anatomical position. When we look at the elbow, once we decrease this angle here, that's flexion. And once we open it up and lower this, now we have extension. Same thing with the hip. If we start in neutral position and we decrease the angle, we're flexing. Once you go back to neutral or anatomical position, you're in the process of extension or extending it. But once you go past anatomical position, we're now hyperextended. And the same thing with the wrist. When you bring the wrist in this direction, that's called flexion. If we go back into neutral in this direction, it's extension. And if we go past anatomical position, it's hyper extension, which is what we see in this picture in the black to the right. We have flexion of the wrist. If we go back this way, it's extension. And if you go beyond that, it's hyper extension. Let's look at abduction and adduction. When we talk about abduction, it means moving away from midline. And when we talk about adduction, you're moving towards midline. So if this person itself is midline, bringing the arm away, when you get abducted by the aliens, you are taken away from midline. That's abduction. When you're bringing it towards the body and adding it to the midline, that's adduction. Same thing with the lower extremity. When we move the thigh away from midline, that's abduction. And when you move it towards midline, it's adduction. And the same thing for the wrist. We're starting in anatomical position. If we move the wrist towards the trunk, it's adduction. And if we move the wrist away from the trunk, we call it abduction. Now, since the radius is on this side, we call it radial deviation, if we're going this way. And adduction is sometimes called ulnar deviation because you're moving it towards the ulnar bone. So adduction is ulnar deviation. Abduction is radial deviation. And on the upper right is a close-up view of what abduction and adduction of the wrist look like. Now, fingers are a little different. Now, fingers, midline is the birdie. Midline is the third digit. This is the reference point. When you move the fingers and spread them apart or bring them together, it's not in reference to the trunk. So the third digit, digit number 3, is the reference point. So if digits number 1 and digits number 2 and digits number 4 and 5 are close to digit 3, then they're adducted. They're actually moved towards midline. If you spread them away from the reference point, which is the third digit, and you move them apart, that is abduction of the fingers. Okay. Circumduction is unique. Circumduction is something that we use, especially for the shoulder, is when it combines a bunch of actions together, like flexing and extending the shoulder, and abduction and adduction all at one time. And most of the time, it's like making the circular movement of the shoulder or throwing a baseball, moving it all around. That's called circumduction. It's when you're combining a multitude of actions together. Let's look at rotation of the spine and rotation of the limbs. When we talk about medial rotation, that's interchangeable with internal rotation. And we talk about lateral rotation, that's synonymous with external rotation. Okay, so that holds true with the upper and lower extremity. When you see medial rotation, it's internal rotation. When you see lateral rotation, it's external rotation. So if we look at the head, generally speaking, simple enough. There's left rotation and right rotation, depending on which shoulder you're rotating your head to. But with the upper extremity, when you're rotating so that the palm is face up, that is external rotation or lateral rotation. And when you're rotating the limb so that the palm is facing down, that's medial rotation or internal rotation. So these are opposites: lateral rotation and medial rotation, or external rotation and internal rotation. And most of the cervical rotation takes place between C1 and C2 vertebra at the atlantoaxial joint. That's where left and right cervical rotation come from. Now, when we're looking at the elbow, right, this action here for lateral and medial rotation, the reference point, we're really looking at the arm, right? Where is the greater tubercle as the reference point? Is that moving medially or is it moving laterally? That's how we come up with lateral and medial rotation. But when we're looking at the elbow and the forearm, now palm up is supination. That's because you're holding sup in a supinated position. Or pronation is when you're prone to spilling it, where your palms are face down. Okay, so the best way to assess supination and pronation is really with the elbow bent at 90 degrees, because now rotating the forearm is really pure supination and pronation. But if your elbow is extended and you're internally and externally rotating the shoulder, that can kind of mimic supination and pronation. But with the elbow bent at 90 degrees, supination and pronation is purely supination and pronation. You can't mistake it for shoulder internal and external rotation. The other unique movement involves the foot, which is inversion and eversion. Inversion is bringing the sole of the foot inward, and eversion is where you try and bring the lateral side of the foot up. Inversion is a whole lot easier to move than eversion, which is why inversion ankle sprains, like slipping down a curb or slipping down the steps, and then you'll notice this part of your ankle on the lateral side is all swollen and bruised and black and blue. So plantar flexion and inversion injuries are super, super common. Also at the ankle, we have dorsiflexion at the ankle, and then we have plantar flexion of the ankle. So plantar flexion is when your, let me see if I can erase this here. That was a little messy. Plantar flexion of the foot is when your toes are planted downwards. And then when you're walking on your heels, that's dorsiflexion. Okay, dorsiflexion, plantar flexion. We use these terms, dorsiflexion and plantar flexion, to replace the typical flexion and extension terminology that we would use of other joints. Okay, so I want you to get familiar with dorsiflexion and plantar flexion, not flexion of the ankle and extension of the ankle. No one really uses those terms. It's always dorsiflexion or plantar flexion. Another unique term is called opposition. And the only parts of the body that can do opposition is when the thumb touches any other finger. So when the thumb touches the pinky, or the thumb touches the first, second digit, or third or fourth, we call it opposition. And there are muscles here of the thumb and muscles here of the pinky that are called the opponens muscle, opponens pollicis, or opponens digiti minimi. So opponens is really unique to these two digits, the thumb and the pinky, because they have their own opponens muscles, opponen pollicis and opponens digiti minimi. Another unique term is protraction and retraction, applying to the jaw. When you stick your jaw out, that's protraction. When you bring the jaw in, retraction. So you have protraction and retraction. Then we have depression and elevation. So when the mouth is closed, you're elevating the mandible. And when the mandible goes down, you're depressing the mandible. So we have elevation and depression. Lateral bending, when you holding a phone against your ear, side to side movement, is what we call lateral bending or lateral flexion. So this would be right lateral flexion, and then you have left lateral flexion.